saying, open your mouth and ask yourself, have I ever seen a dentist before? By the time we're done with our conversation today, you will know why you have to, if you've never done it before. Why you have to see him often to ensure that your oral health is sorted. I guess this morning, Dr. Michael Awua is a dental surgeon joining us this morning. Hey, surgery in the mouth, man. Okay. Well, good morning to you. Thank you for coming.
Good morning to you too. How are you
And
doing?
I'm good. This mask of yours is a very interesting one. What's the story behind it?
Oh, it's just a cloth mask.
Cloth mask,
Yeah.
Special cloth mask.
Not really special.
Does it have anything to do with oral health?
No. It's
Okay.
much more comfortable to wear.
Okay, I hear you. Let's share with our listeners the science news for today, then we will get talking. A new study has provided evidence that natural cocoa has the potential to improve the memory of persons aged over 50 years. Another new study has found that the smell you get when in a new car is actually the smell of carcinogens. That is cancer-causing chemicals. And as such, journeys in such cars should not be done with the windows rolled up. Finally, recent reports suggest that the UK COVID-19 variant may be up to 70% more deadly than original strains of the virus. That's your science news for today. A couple of new studies and two very troubling ones. So you buy a new car, you like the smell. Apparently it's cancer causing. Hey, Sandy Bar. Say to why? Why would they put in that, cancerous in the car for us to breathe in? But a new car, I want to smell the car small. You have to roll down. Oh, anyway. Doc, good morning once again.
Good morning to you too.
So, share with us your story in 5 minutes. How did you become a dental surgeon?
Okay, so back in junior high school, I actually wanted
No, take us to primary school. Where were you raised?
Okay, I was raised in Accra.
Mm-hmm.
I schooled at Morning Star School.
Morning Star.
I can't-
Morning Star.
Yes, Morning Star.
Okay, all right.
Yes, and back then I wanted to be a mechanical engineer.
Mm-hmm.
Moved on to senior high school at Prempeh College.
Prempeh College.
I'm a proud amount for.
Okay.
And that's why I started doing science, and I was exposed to anatomy.
Why
and,
science?
It's quite fascinating. Science in terms of anatomy, get to know how certain living organisms actually work. It's quite
So
fascinating.
more of human mechanical engineering.
Yes, exactly.
Okay.
And before uni, I shadowed some few dentists in my community, and I realized that dentistry was a place to be in terms of the fact that there's a very good work-life balance. As a dentist, you're able to put a smile on the face of people who couldn't even smile at first because of bad teeth. You're able to put people out of pain. In terms of finances, it's okay, it pays quite well. And you're able to educate people on good oral care.
Okay.
Yeah.
Okay. So that's what attracted you
Yes.
to the mouth
Yes.
and being a dentist.
Yes.
And a dental surgeon.
Yes.
Money is good. You can still do buccal mechanical engineering. That makes some good cash while doing it. Okay, that's good. That's good. You've recently been doing some videos on TikTok, I hear.
Yes.
Wow. Tell us more about that and what's been the response?
Okay, so first of all, the role of a dentist doesn't just end in the dental chair or the dental clinic. It goes beyond that. Patient education is as as important as patient treatment. So, let me give you an example. The average Ghanaian would only visit the dentist when he or she is in pain. And before they even visit the dentist, they would have tried some herbal concoctions, done some home remedies and all. And we ask ourselves, what's the reason behind that? It's because of low dental awareness. So I'm trying to use these audio, visual, digital means to try and educate the general public on the best ways to take care of your teeth and also the need or the importance to visit the dental clinic. And the response has been good. I've been able to do a couple of videos, added a bit of satire to it. People
got more followers too.
To it, yeah.
Okay, that's That's fun and learning at the same
Yes,
time.
exactly.
Okay, that's great. So, what is the typical? No, before we head to that, is there a difference between a dentist and a dental surgeon?
Okay, so it depends on your country. For instance, certain countries try to differentiate between the two. Others to use those terms interchangeably. In Ghana, after your 6 years dental course, you are awarded
6 years.
Yes, 6 years.
Oh boy.
You're awarded.
So you're a mouth doctor.
Yes.
Okay. Wow, 6 years.
Yeah, 6 years.
Oh boy. My mouth call.
Yeah.
6 years.
Yeah, 6 years and 2 years internship before you get a license.
Wow. What? A medical doctor, a GP, is how many years?
Also 6 years.
6 years.
Yes.
But if the whole body learning is 6 years, why is just the mouth also 6 years?
Okay, so first 3 years we do what our colleagues in the medical profession do.
Okay.
The last 3 years we more or less switch or branch into.
Oh, so
the
more.
shape of
Okay, so more like you all do the GP course,
Yes.
but you specialize towards the end.
Yes, I'll say we branch. I wouldn't say specialize.
Okay.
It's a different thing. Yes,
Okay,
yes,
that's
yes,
fine. Okay, so still the difference, yeah.
Yes. So, in Ghana, you are awarded the BSc BDS. That's the Bachelor in Dental Surgery.
Okay.
Yeah. So at the end of the day, you're a dental surgeon. But however, go to certain countries, they try to differentiate it that after you're done with the 6 years and you specialize in the field like oral surgery or oral or maxillofacial surgery, that's where you can be called an oral surgeon or a dental surgeon. But in our case, we use dental surgeon and then dentists interchangeably because we're working within the mouth. They're surgeons of the mouth.
Okay. You have explained the nuances per country, but in principle, is a dental surgeon also a dentist?
Yes.
Okay, that's fine. So that helps me to appreciate the is it nomenclature or whatever it is? Okay. So what does a typical working day look like for you as a dental surgeon?
Okay, so a typical working day, we try to prepare the surgery before seeing patients. We make sure our tools are properly sterilized in autoclave. We make sure the places, the working surfaces are disinfected. And since we are in a pandemic, we also make sure that the receptionist triages the patients. So there are certain checks, pre-appointment checks that we do. We ask the patients certain questions to triage them. We do the...
When you say triage, what do you mean?
Trying to separate people who are, let's say, likely to have the virus. Yes, we triage them. Once we suspect, we can go ahead to probably, I would say, like, let's say, delay the treatment a bit, make sure that they are fine, because most of the dental procedures are elective cases. They are not really emergency cases, per se.
Okay.
So we do the pre-appointment checks. Afterwards, once we have the patients in the chair, we take a detailed history, a thorough examination, and we do certain investigations. When I say investigations, I mean
103.5
radiographs
StarrFM.
Confirm our diagnosis. Afterwards, we elaborate or discuss the treatment plans for the patients before we met out treatment. And at the close of the day, we disinfect the place again and we sterilize our instruments.
Okay.
Yeah.
Okay. Do you also do long hours like regular medical doctors?
Depending on your field, I'm a general dentist. I do the usual, let's say, 8 to 5 or 8 to 4. However, we have certain specialists like the maxillofacial surgeons who can be... Okay, they are specialized in the head and neck tumors, cancers, anything, even fractures of the head and neck. They're the ones who take care of that. They can be called at any time, 24 hours, because it's more of an emergency type of dentistry. Yeah.
Okay. Oh, it's dentistry.
Yeah.
All right. Let's talk about bad breath, shall we?
Yes.
What are the most common causes?
Okay, so first of all, bad breath is a noticeably unpleasant odor from the breath, whether it's coming out from the mouth or emanating outside the mouth, so term it as bad breath. The causes, we have causes that don't have any significant or underlying disease or systemic disease causing it. For instance, you wake up in the morning, you may perceive a bit of bad breath. It's physiologic, it's normal. Dry mouth can give you a bit of bad breath. You can also have smoking causing bad breath. Also, certain foods, let's say onions and garlic, can give you a bit of bad breath. But once those elements are taken away, the bad breath goes away.
Taken away means what? If you wash them, flush them out, what?
Like if you don't eat them, or let's say you eat them and after a period of time, the bad breath starts to die down. It's not chronic.
Okay.
It's just for a short period
Okay.
of time.
Okay.
And as I said, dry mouth, you need to hydrate often. If you don't do that, you can have that. And we've got causes that signify they are as a result of an underlying disease. And these ones include tooth decay. Tooth decay can give you bad breath. Gum disease can give you bad breath. Poor fitting dentures can give you bad
Poor
breath.
fitting dentures, meaning what?
Okay, so there are certain people who wear dentures for a very long period of time. They start becoming loose, and you end up having food packing in between the denture and the mouth, and that can give you...
As in the ones who wear braces?
No braces, replacements, tooth replacements
Okay.
that are removable.
Okay.
Yes, those ones, those poor fitting, they just can give you...
Can do that. So, for instance, if someone has a chipped tooth,
Yes.
it can cause bad breath.
It can't cause...
More like
bad
a hole
breath.
in your teeth.
A hole in the tooth, because it serves as a niche for food to pack inside.
I see.
Yes.
I see. Okay. Are all bad breaths caused by what you've mentioned only in the mouth, or some can come from your throat?
Oh yes, you can actually have bad breath outside the mouth. Something called tonsillitis. It's actually an inflammation of your tonsils. The tonsils are these structures located at the back of your throat. Once they get inflamed, they start to give off a bit of an offensive smell. And even chronic sinusitis. That's an infection of your sinus. Those are some structures around your nose area. They can give you a bit of bad breath. You can also have nasal obstructions. Anything that blocks the nasal passages can give you bad breath.
So if you have cold or sinus,
Yes.
you're most likely to have bad breath.
Yes, it's possible you can have it. And even pneumonia can give you a bit of bad breath.
Wow.
Gastric ulcer. You can have even liver, kidney disease, and even diabetes also giving you
I see.
bad breath. Yeah. So
see.
when somebody has bad breath, you need to go through all these to make, the causes in the mouth first, and then we start thinking of causes outside the mouth. And one cause I forgot to mention was tongue coatings. Very important.
Tongue coatings.
Yes,
What's
people
that?
who don't brush their tongue, they start to accumulate a bit of bacteria on your tongue, and this gives off an offensive smell.
Yes.
Yes.
So, quick check. If somebody for a couple of days does not brush the teeth, if you see a certain white deposit on your tongue, it can cause that.
Yes, it can cause that. Whitish, brownish deposits.
Okay.
Can cause
So your tongue ordinarily has to be what color?
let's say a bit pinkish.
Okay.
Should be fine.
With no white deposits.
It may be a little white, but not a coating white on the
Okay.
tongue. No, it
Okay.
shouldn't be that.
Okay. Does the nature of your breath determine your health status? So, for instance, if somebody has a very offensive mouth odor, does it indicate that the person has a certain sickness or is unwell or something of the sort? Is this an indicator of the body not being too well?
Yes, it can be an indicator that the body it's not too well, especially if we are considering the extraoral. Why I say extraoral causes of bad breath outside the mouth. Once we've been able to work on your oral hygiene, we've done everything in the mouth, and realize that you still have the bad breath, then we start becoming suspicious that it could be a systemic infection, meaning it could be a general body infection that is giving off that form of bad breath.
Okay.
Yes.
Between young children, adolescents, and adults, are there some conditions that are unique to any one of those groups?
Yes, there are certain conditions unique to some of the groups. For example, with young children, some children are born with certain conditions such as cleft lip and palate. When I say cleft lip and palate, it's this fissure or this division on your upper lip or even your lower lip when you're born, or on the roof of your mouth. So whenever the child suckles on milk, it moves past the mouth and sometimes even enters the nose. This is quite common in certain children, and I want to take this platform to commend one lecturer of mine, Professor Peter Donko. He spearheaded the Ghana Cleft Foundation. He's actually the president, and he's done a lot for Ghana when it comes to cleft. And since 2003, he's been partnering with the Smile Train to bring a lot of smiles to the faces of children with such conditions.
Okay.
And children also tend to have tooth decay.
103.5 Star FM.
When it comes to adolescents, malocclusion or the arrangement of teeth. It's quite common amongst them, and that's why you see a lot of these adolescents wearing braces.
Yeah.
These are these metallic things placed on the teeth to help with the arrangement.
We had a funny laugh about that a few weeks ago. If you remember the conversation about Ronaldinho and the fact that once he wore the braces, all his football skills left. I mean, the minute he tried correcting that teeth matter, then all the skills that we used to love disappeared. But that's just for us, by the way. Yeah.
And with adults, you have a bit of tooth decay too going on, especially if it's an untreated tooth decay from adolescence or teenage years. It moves all the way to adulthood. And also, most of them tend to complain of something we call a complication of an impacted wisdom tooth. Because between the ages of 18 and 22 years, you're supposed to have all your wisdom teeth. That's the very last tooth in your mouth. You're supposed to have it fully in the mouth, but there are some cases that some people inherit, let's say, a small jaw from their mom and maybe big teeth from their dad. So there's inadequate space in the jaw for the teeth to appear in the mouth. So
no fault of theirs.
No fault of theirs. So you have a bit of gum covering the tooth. So whenever food packs beneath the overlying gum in the tooth, it starts to cause a bit of pain. It's quite common at the clinic. So whenever they come, we take x-rays, see how the tooth is positioned in the jaw, and possibly you consider having it taken out for them.
I see.
Yeah.
I see. Interesting. Okay. My guest this morning is Dr. Mike Liwamensa. He's a dental surgeon. We're talking oral health this morning. We're learning quite a great deal today. So, in some movies, you see the use of laughing gas in the dental office. Is this a real thing or it's all made up?
So laughing gas is a layman's term, but actually the scientific name is nitrous oxide.
Okay.
It's used at the dental clinic. It's a mild sedative that's used to calm patients down, reduce anxiety during dental treatment. Yes, we give patients anesthesia in the mouth to numb the tooth. However, the nitrous oxide is an additive. It's more or less something that helps to calm the patients down even before we even start any treatment. Some few dental clinics...
Why is that important?
Some clients are actually scared of the dental clinic. Even the smell of the antiseptics used to clean the place even puts them off.
Wow.
Yes, so sometimes it's quite necessary to sedate them with this mouth sedative.
Do they know you do that to them?
Oh, it's actually something that is explained to the patient. You get consent from the patient before you actually do it. But
so
it's not too
if
common.
I get that in my studio here, and then people come and they are feeling it and they are just answering my questions without me knowing, is that illegal?
Oh, you see, with laughing gas, you actually place a mask on the patient.
Oh,
so
okay. It's not like you can float in the air.
No, it's
Okay.
just something floating in the air.
Okay. Interesting. Is there a global standard for what perfect teeth looks like?
Okay, so I will talk about perfect teeth. As I always say, beauty lies in the eyes of the beholder. However, when it comes to dentistry, we have something we call occlusion, how the teeth come together or how the teeth meet when you bring your teeth together. There are certain instances that some people's teeth don't even meet when they bite. For instance, their front teeth, they may bite at the back and realize the front teeth are not meeting. It's a form of malocclusion. So malocclusion means the teeth are not being arranged properly. Some people too also have...
What is that? God?
Oh, you see, some of them are genetic, some of them are habits.
Okay.
That cause them.
What habits? What kind of habits
For
can cause that?
instance, when you're a child and you start to suck for a very long time, you can cause that form of open bites, that's the space between the upper teeth and lower teeth when you bite, and also tongue thrusting. So certain children tend to thrust their tongue between that space, and it further widens that gap there. Yes.
Interesting. Okay. Okay, so there's no global standard for what perfect teeth looks like.
It's something similar called occlusion. We have ways of classifying it. So if your teeth don't come together in a certain way, we classify it. We've got class 1 malocclusion, class 2, and class 3. So whenever it comes to the dental clinic, we assess all that to see how the teeth come together when you bite.
Okay.
Yes.
All right. Let's bring you our science fact for today. And it's a very interesting one. There are over 6 billion bacteria, and that can be found in the mouth. 6 billion bacteria in the mouth. 6 billion. God, convert it to cash. Give it to us. Take away the bacteria, make it dollars, and give it to us. Yeah, that's our science fun fact for you today. Doc, did you know this?
Yes. And most of them are on the tongue. That's why it's very important.
Oh, really?
Yeah.
Okay, is it harmful bacteria?
There's good bacteria and there's harmful bacteria.
Okay.
Yeah, so there should be more or less like a balance.
How do you tell what kind of bacteria is in your mouth?
You can't tell that by just looking, but if your oral hygiene practices are poor, you start to have certain problems.
So it can be more than 6 billion if your oral health is bad.
It's just around 6 billion.
Okay.
Yeah.
Okay. So, all right, we'll talk about the basics for oral health care before we end the conversation this morning. What's your professional opinion about people with a gap tooth? Diastema is what they call it?
Yes,
okay.
diastemas. Yes.
Is this something to be corrected or it should be left as it is?
Okay, so diastemas are actually caused, they could be the genetic cause that if you have a big jaw and smaller teeth, you end up having spaces in between some of the teeth. And also, there's this tissue between the gum region and then the tooth. If it's very thick, it tends to widen the space between the two front teeth. Yeah, so these are the two main causes for the diastema. But with diastema, it solely depends on the patient. The onus is on the patient. If the patient feels it's not aesthetically pleasing and want to close it, there are several ways of doing that, through the use of braces, through the use of fillings that can be pleasing those regions.
What causes that, by the way?
If as I said earlier, genetic-wise, in case you have smaller teeth and you have a big jaw, obviously you have some spaces there.
Okay.
And also that tissue found between the two front teeth, if it's very thick, it tends to further widen that space there. Yeah.
Does it have any health effect?
No, it doesn't have any health
At all.
effect at all.
So for those who like it, they can keep it.
You can keep it.
No problem at all.
There are even people who even come to a clinic for us to even create
diastema for them.
Yeah, some people actually go to clinics.
Really?
Diastemas created for them. Yeah.
Really?
Yes, they
What
do.
for?
They find it in their
Does it have
culture.
any benefits?
No, but they find that in their culture, it's widely accepted that beautiful people should have diastema. It's like beauty spots on people's bodies.
Okay.
Yeah, it's
So they come for procedure,
some people.
and you are able to do it for them.
I don't advise them to do it.
You don't advise them to do
No,
it.
but
Why?
people actually, because you're cutting away healthy tooth tissue just to have a space there. Because
But
once
if it's naturally there, it's fine.
it's fine. Because once tooth tissue goes away, it's not going to come back again. So why then cut away healthy tooth tissue? Yeah.
Okay, because I've heard some very, very funny stories about the estimate and what it can do for you if you have a partner. I mean, all manner of things. Fifi, you've heard about that too, right? Oh, you haven't. You are denying knowledge today. It's fine, no problem. I'm alone on this one, but I know what I know. It's fine. Teeth whitening. Is this something? Is it a common practice in Ghana? And are there any health benefits?
Lately, it has become a really popular practice. But ideally, teeth whitening should be done by a dental professional, because there are certain side effects associated with teeth whitening. It's only the dentist or dental professional.
But let's take it step by step. What is teeth whitening?
Okay, so teeth whitening, also known as teeth bleaching, is the use of certain chemicals such as hydrogen peroxide and carbamide peroxide to make the teeth whiter. That's teeth whitening.
Okay.
Yes.
Is there a reason why that's important?
Some people don't like the color of their teeth and they're going for that. But before you even consider teeth whitening, you should be able to see your dentist to ascertain the cause of the discoloration, because teeth whitening doesn't work for everybody.
Oh,
Yes.
So you can do it as much as possible, it won't work.
Yes, because if the cause, for instance, is as a result of plaque and tartar, calculus, those deposits, yellowish things that form on your teeth, if you do teeth whitening, it's just going to whiten those deposits there. So the ideal thing for such a situation would be to do scaling and polishing, that's dental cleaning, to remove those yellowish and greenish deposits around your teeth. Teeth whitening wouldn't help you with that. And also, people who have certain discolorations like tetracycline-induced discolorations, when they were younger, maybe they were put on certain medications for a longer period of time, and when they grew older, the teeth became a bit discolored. If you do teeth whitening, it wouldn't
It won't work.
teeth.
So before you do teeth whitening, you must get an assessment done by a dentist.
Yes.
And based on that, they will know whether you qualify to get it done or not. So for those who go and do the laser whitening, what do you tell them?
I'll advise that you see your dentist first.
Before you go ahead.
Yeah.
That's fine. As we are in the era of COVID, I'd like your professional and personal opinion on the use of hydrogen peroxide.
Okay, so hydrogen peroxide has been used for decades in the hospital setting, especially when somebody has a minor cut on the body, a bruise. It's even used for disinfection. However, due to the pandemic, it's being used as a mouthwash, especially at the dental clinic. When COVID started, we're diluting it to use it for rinsing of the mouth for 60 seconds before doing a procedure. What that does is that through its oxidative process, it's able to reduce the viral load in the saliva, because we've realized that saliva is one of the major routes for the transmission of COVID. So that helps to reduce the bacterial load even before we look into the patient's mouth or do any procedure, because most of our procedures are aerosol generating procedures. So we tend to have aerosols splattered all around the dental clinic. However, on the 4th of February 2021, the Ghana Medical Association brought a statement out with regards to the use of hydrogen peroxide.
Yeah.
Yes. So they made mention that presently hydrogen peroxide has not been approved, authorized, or recommended by the Food and Drugs Authority, Ghana Health Service, Ministry of Health, World Health Organization, or any other reputable international drug or health regulatory body for the prevention or treatment of COVID-19. They also made mention that there has been some published observational studies both within Ghana and abroad that suggest that hydrogen peroxide may be used for the prevention of COVID-19. However, these do not constitute sufficient proof that it will work in human populations to prevent or treat COVID-19 at this present moment. And they also give some suggestions that the general public is advised to handle the product as any other medicinal product, and that the misuse of same could lead to serious physical and undesirable medical consequences. The public is also advised to consult appropriate health professionals or prescribers before they purchase such products. For example, the hydrogen peroxide available in Ghana right now, the concentration is between 3 to 6%, but you shouldn't use that same concentration to rinse your mouth. You should dilute it to about 1 to 1.5% before you use it.
How will I know that I've diluted to that level? How do I go about it?
There's a dilution factor used to calculate it. That's how come it's best you see your health professional before
you do so.
It. Yes, or else you realize that the mucosa in your mouth will start to peel off, because it starts to kill off the healthy cells in your mouth.
Interesting.
Yeah.
Okay. So, what's your advice? I have to come to you before I use it?
Yes, you should seek professional opinion before
I
you use it.
I see. So if I have my cup, I pour more inside, put my water inside, and use this one to have to come and see you before? I have to come and see you.
Because there may even be a point that maybe you have certain ulcers in your mouth, which will maybe even deter you from using it, because if you use it, may cause a burning sensation. There's a fresh wound in your mouth, so you need to make sure that you're okay before you go ahead to use it.
Okay.
Yeah.
What are your top tips for maintaining good oral health during this period and going forward?
Okay. During this period, we really need to maintain a good oral hygiene, because the pandemic is really restricting us from doing a lot of things. Certain things like brushing your teeth twice daily with a soft bristle toothbrush and a fluoride-containing toothpaste is very important.
Yeah.
I can't overemphasize that. Many people like
soft, not hard.
Not hard. Yes, many people like to use the hard bristle toothbrush because they feel that's what's able to
scrub the cells off,
make it whiter. But no, it doesn't do that. The hard toothbrush tends to wear away the protective layer of the teeth, referred to as the enamel, and it's also going to cause damage to the gums. So it's best to use a soft bristle toothbrush. Change your brush at least once every 3 months.
But see, Doc, you are confusing us, because I mean, Fifi, we all buy toothbrush. There's the kind where they'll tell you that depending on the way your teeth is, you must get a hard one. So when you're scrubbing the teeth, you know you're removing things. You still say we should use soft ones?
Yes, she's a
so
soft
so what?
one.
Nobody should buy the hard ones
The hard one is not advisable. You're going
at all
to-
for anybody at all,
No,
even
no.
smokers. At all.
No, at all.
Okay.
You damage your teeth.
I see.
Yes, yes,
I see.
Yes. So
So we should avoid hard toothbrush at
yes,
all costs.
avoid hard toothbrushes. Yes.
Wow.
And you change your brush every 3 months, or if you realize that the bristles of your brush are starting to fray or look outwards, you need to change it before the 3 months.
Every 3 months.
Yes, whichever one comes first.
Okay.
Yes, and you should also be using fluoride-containing toothpaste. There are so many toothpaste on the market. However, as dentists, we advocate for toothpaste that contain fluoride. So you can use any toothpaste you want, but make sure that there's fluoride indicated as part of the active ingredient.
What does it
of
do
the
in your
ones.
mouth?
So fluoride gives extra strength to the outer layer of the tooth. So it makes it resistant to the acids produced by the bacteria in your mouth. And it's these acids that cause tooth decay. So once fluoride is keeping the outer shell of the tooth very hard, it becomes resistant to acids.
Okay.
Yes, and you should also brush twice daily. However, don't brush immediately after eating. It's bad.
Why? Why is it bad?
Yes, so you should wait for at least 30 minutes before you brush your teeth after eating. Because immediately after eating, there's something we call an acidic challenge. There's a production of acids in your mouth within 30 minutes. And if you brush within that period, you're just going to rub the acids all over your teeth. Saliva plays an important role in buffering or reducing these acids in your mouth. So you need to give saliva that opportunity to reduce the acidity. So in that interim, what you can do is that you can rinse your mouth with a cup of water, what we call swish and swallow. You do that, or you can even chew sugarless gum. Sugarless gum contains xylitol. It helps to kill certain harmful bacteria in the mouth, and also the action of chewing gum helps with saliva production. So it's quite important you do that.
Okay.
Yes.
Okay. This question is very important for me. So you have a friend who has a bad mouth odor. You've realized it for a while. It worries you. You think your friend needs help. What's the best way to communicate it?
Okay, so the best way, this is a pretty tough question. Certain clinics actually offer coupons that you can give out to friends and family. Probably you can even do a hamper and include that coupon. So in case the person sees it, you'd go actually want to try it out, but tell the person directly, it's a bit difficult. As a dental professional, you can tell clients when they come to the clinic that, I can perceive a bit of bad breath, but you as an individual, it depends on your relationship that you have with
There are
it.
some people, they are very, very harsh. We just look at you and say, well, no bone. I mean, just like that. And it can be very offensive. I mean, whoever is having that experience may not look at the bit to do something about it, or will feel offended that you are actually just insulting me. So you're saying the best way is to get what?
Sometimes coupons, and also outreaches that are done at certain institutions. There are certain institutions that have outreaches, like health outreaches, maybe every year, or maybe once every 6 months. So during those outreaches, dentists like myself, we check the mouth, and if there are any things that cause bad breath, we speak to the person in question and let them know that, you have ABCD. We write it on a piece of paper referral, and we ask you that, if possible, please pass by the clinic so we can actually sort it out for you. So that is also good when it comes to institutions, the outreaches that they do. We're able to actually, we the dentist, tell certain people with bad conditions like mouth odor what they need to do to have it sorted out.
Okay.
Yes.
Gum. What's the best time to chew it? And what's the worst time to chew it?
Chewing gum, I'll say you should chew sugarless gum that doesn't contain sugar. It can be chewed at any time. There's no time or frequency for that.
Okay, at any time.
Yes, but it should be sugarless.
Why is the sugarless one the best option? What's wrong with with the ones that have sugar?
Okay, so sugar is a substrate for the bacteria that causes to decay.
Okay.
Once that bacteria gets sugar, it's able to break it down to produce acids, and it's these acids that causes to decay. It causes holes in the tooth. So if you're going to chew something for a long time that contains sugar inside, you're going to have a bit of a rampant form of tooth decay in the mouth. So it's best you chew on sugarless gum.
Okay. Paco Young just tweeted at us. He said, "Good morning, Francis. Kindly ask the dental surgeon, do we brush before breakfast or after breakfast?"
Okay. There are two schools of thought for that. Others suggest that when you wake up, brush before you eat. Others too also say that you eat before you brush. Okay, so the first school of thought, if you're going to eat immediately you wake up without brushing, you should have brushed the night before. You should have brushed the night before.
Oh God. Okay, why is that?
Yeah, because during the day, you've accumulated a lot of food debris within the mouth, and you're going to sleep for about 6 to 8 hours with all this in your mouth.
Yeah.
You wake up in the morning, you're just going straight ahead to go and eat. You're just going to worsen the whole situation. So something like that, if you want to eat immediately you wake up, you should have brushed the night before. And also those who brush after eating, it's best you wait 30 minutes before you brush. As I said earlier, there's an acidic challenge in the mouth when you're done eating. And it's also important to brush. Those who say you brush before you eat, it helps to clear the mouth, also stimulates saliva production and all that. And it's also good. So it depends. It depends on the school of thoughts that you trust.
Okay. Yeah. Can you brush more than twice a day?
Yes, you can brush more.
As many times as possible.
Yes, but you should make sure that it's 30 minutes after you eat. You don't brush immediately.
Okay.
Yes.
Okay. Flossing. What is it?
Okay, flossing is the use of a thin filament, sometimes impregnated with fluoride, sometimes not impregnated with fluoride, that's used to clean in between the teeth. So realize that if you brush your teeth and you don't floss, you miss about 35% of the surface of your teeth. You've not done much work. So it's very important that whenever you brush, you floss your teeth.
You must brush and floss.
Yes, not just brush.
What do you use for the floss?
Okay, so the floss, it comes in different forms. We've got the regular or the conventional floss. It's a box. You pull a long thread out, about 18 to 24 inches, wrap it around your fingers, and you go between your teeth to clean it. And we've also got something called the floss pick. It's a small plastic that has a small thread attached to it, which is used to clean in between your teeth. And we've also got something we call the water floss.
So which one is this one?
That's the floss pick.
Floss pick?
Yes.
Okay.
Yes. We've got the water floss. So the water floss is an equipment.
What's that?
I think this is the regular floss. Yes. So
this one?
Yes, that's the regular floss. So that's the floss pick. And with the water floss, it pushes water at a high pressure in between your teeth, and it's also able to clean in between.
So this is the one you pull out.
Yes, you pull
and then
this
you use.
out. Yes, and then you wrap it around your middle fingers and you guide it into the teeth. But most people complain about using the floss. They say that they bleed whenever they use the floss. There are two things. It's either you are not flossing properly, that's you pushing the floss too much into the gum, so it will cause it to bleed. Or it could be that there's an underlying gum disease. Probably you've accumulated a lot of plaque deposits there, which has triggered some gum disease. And some of the signs of inflammation is pain, swelling. So in case you push it a little bit, it's going to cause the gums to bleed automatically. So these are the two things you should look out for if you're bleeding when you floss your teeth.
I see.
Yes.
Toothpick. What do we do with it? Should we still use it?
Toothpick.
You're done eating. You just want to, They say it's actually it's a rich man's trying to flex that I ate meat. So yeah.
You should be careful when you're using a toothpick, because if you don't use it properly, you can easily traumatize the gums. So whenever you finish eating, it's better you use a floss. That's the best tool for you cleaning in between the teeth rather than using the toothpick. You may injure yourself when you do that.
Okay.
Yeah.
All right. What else have I left out? Fifi, anything else? Or we're done? We're good? We're okay? Okay.
And also, you shouldn't be using your teeth to open bottles. It's very common how most people, whenever they go to the pub, they don't have...
In the absence of it, chale. Yeah. But why? Why shouldn't you do that?
If you do that, you're actually going to cause fractures to your teeth. Your teeth can fracture. Yeah. So people who usually open bottles with their teeth, when they come to a clinic, I'm able to see it, because there are certain teeth that usually chip off whenever you try to use your teeth to open it. You should also avoid chewing ice.
Oh,
People like chewing ice
look,
a lot.
where you are going, I have to stop you. Otherwise, you will tell us not to do anything with that mouth again. Seriously?
Yeah, it can cause fractures on your teeth.
Okay.
Yeah.
This is a very touchy subject, but I suspect people will still want answers to it. Somebody just sent me a message that considering the level of bacteria in our mouth, what would be your advice for oral sex?
Okay, that's fellatio.
Yes.
Yes.
Both for the man and the woman.
Yes. With regards to that, bacteria can be shared amongst individuals. You understand? There are certain bacteria that are actually found in the mouth only. And if you start to engage in fellatio, you may start getting certain bacteria that are not supposed to be there in the mouth, and that could also cause some few issues here and there.
So what's your advice? They shouldn't do it at all?
With that word, I think it would be a personal
If you were to advise, what would it be?
I wouldn't advise that.
At all?
Yeah.
At all?
Yeah.
Be it on a man or on a woman?
Yeah.
At all?
Yeah.
Wow. You are getting yourself in trouble. Because what? It disturbs the pH for your mouth and also for the person?
Yes, exactly.
I see. What are the effects of it? Are there any health complications that come with it?
Yes, in terms of the fact that certain bacteria in the mouth, there's an issue with the balance of the bacteria in the mouth. If you are not too careful, you can sometimes end up with certain ulcers in the mouth. You can also end up with one form of oral candidiasis or thrush. Sometimes, yes. So it actually depends, because once the bacterial balance is lost, now it gives him way for certain organisms to flourish more, such as some certain fungal infections in the mouth and whatnot.
So you are best off not doing it at all?
Yes.
So those who say do it in the name of love, what do you say?
The always lies on them.
Okay. Can it be done sparingly or at all?
That's right. It would be a personal
decision.
Yeah.
Okay. All right. Okay. If it's bad in the first place, then you shouldn't be doing it to multiple people, because you could even put it in more trouble. Okay. All right. Okay. Doc, thank you for your time. I think we've learnt a great deal from you today.
Thank you too for listening.
Oral health is very, very important. We should brush at least twice a day.
Twice daily, yes.
The paste must have fluoride in it.
Exactly.
The brush must be soft, not hard.
Yes.
And we must change it every 3 months. Every 3 months.
Yes.
Okay.
You also limit your sugar intake.
Sugar intake.
Yes. Avoid
Okay.
snacking in between meals.
So what do we eat for the snacks then?
Oh, you can take whatever you want.
But fruits have sugar. Some fruits have sugar.
Yes, but it's not the refined type of sugar that the bacteria can break faster compared to certain refined sugars found in drinks and sweets.
Okay.
Yes.
Okay. What chocolate?
Pardon me?
Chocolate?
You can have chocolate, but the frequency and the duration at which you have the chocolate is more. If you're going to eat the chocolate for a longer period of time, you're going to have your sugar levels a bit reduced, and the bacteria now has the ability to feed on those sugars. So if you feed on chocolate just a limited period of time, you take it, that's it. You don't let it linger in your mouth for long. Yes, that's going to be a problem. That's why we advise that you try not to snack in between meals. Rather snack immediately after a main meal, because during that period there's adequate saliva in the mouth to buffer or reduce the acid in your mouth.
The body rests at certain times of the day, usually at night. What's your advice for those who go to sleep, times they eat, what they do with their oral hygiene?
Okay, so if you are the type who usually stays up for long at night, you can eat whatever you want, but you should bear in mind that once you're done eating, you need to brush. You don't sleep with the residues of food in your mouth. You're going to end up with a higher incidence of tooth decay. Yes.
But there are some too who say that if you brush before you sleep, you wake up very hungry in the morning. And then second, the odor in your mouth is actually worse than when you have food in your mouth and you sleep without brushing.
Oh, that's very terrible. You shouldn't do that.
Okay.
And even a clear evidence is with children. There's this form of tooth decay called feeding bottle caries or feeding bottle to decay. There are certain mothers who leave the milk bottles in the mouth of the children, and then they feel that the child can't eat, so that's the best way they can feed the child. But little do they know that they are actually causing more harm than good to the child. So children like that come to the clinic with a lot of tooth decay in their mouth, even with the front teeth. Realize that it's a part a bit black.
Yeah.
Yes. So with that, it's even a clear evidence that you shouldn't leave food in the mouth when you're sleeping.
Interesting. Interesting. Doc, thank you. I think we've learned a great deal. If you leave me, we could go to 12, but let's not. I think we've learned a great deal already this morning. Thank you for your time. Dr. Michael Awua, dental surgeon. Where can we find you?
Currently, I'm on a bit of a break, but I'll resume services very soon.
Okay. So when you do, we will know.
Yes.
So that for those who want to get in touch, you know how to get in touch with you.
So if you want to get in touch with me, you can contact me on Instagram. That's Dr_Awua, Dr_AWA. On Instagram, Twitter, YouTube, anywhere you can find me. And also, you can also access me from my website, www.drawua.com.
Okay.
No underscore there.
Thank you. Dr. Awua, I'm grateful. And that'll be for us this morning here on Morning Star. I've learnt my own bits on what I have to do and not do. Fifi, what did you learn today? Can you tell us? Huh? Is it what I'm thinking? Okay. We're done. We're done for the morning. That's it for me today. Dr. Tom Tego, good morning. That part, it's a very, very, very risky matter. Yes, hey. I'm sure by the time the online story goes, it will generate an entire debate. But that's why we have conversations like this. So this segment of Morning Star, The Horizon, is brought to you in partnership with the Ghana Science Association, helping expand the frontiers of science, tech, engineering, and mathematics education through the power of radio. That'll be